Hi, everyone. As you're starting to sort of funnel in, thank you for coming to this session today. I'm Madison Heyman. I'm an MSW and a research assistant with the Center for Maternal Health Equity and Morehouse School of Medicine. And I will let my colleague, Katrina Williams, introduce herself.
Hi, I am Katrina Williams. I am the Care Management Coordinator for the Center for Black Women's Wellness.
Right, so today we're going to be talking about mental health resilience and inequities. So this study was looking at Black maternal mental health, specifically in Atlanta, Georgia, through a community-focused lens. So we're going to go through what we did and what we learned through this process. Okay. So to get started with just some objectives, we want to understand the importance of maternal mental health, community engaged research, and how those two go together. And we want to be able to describe community engaged strategies to address maternal mental health. So a little bit more about the Morehouse School of Medicine Center for Maternal Health Equity. It's in Atlanta. It was founded in 2019 in response to the maternal health equities we were seeing across the country, across the globe, and in the Southeast specifically. We work all throughout the country. We primarily focus on Georgia, both in Atlanta in an urban setting, but also throughout rural Georgia. So we're growing rapidly. We have a bunch of different projects going on. But the project, like I said before, that we're specifically talking about today has to do with maternal mental health in Black women. All right, so with the center, the mission of the center is to pursue equity in maternal health by reducing maternal morbidity and mortality locally, nationally, and globally. And the vision is to end health inequities in women's health across the lifespan. I do want to take a moment to address that we are saying women, but we do recognize that not only women get pregnant. We're focusing on more of an inclusive environment and language moving forward. We've done a lot of different seminars and talks, so we do want to address that. While these slides are saying women specifically, we do understand that this is not just a women's issue. So again, with the center, we have three pillars. The first of which is research. We focus on translational research. We develop and test various interventions across various different platforms, from everything from technological interventions to community-based interventions to clinical interventions. We also focus a lot on the community. So we focus on capacity building, providing technical assistance to give community tools. With this, we ask the community what they need help with, and we really try and tailor what we do to be able to help the community the best we can. We're an information resource hub. With all of our projects, we aim to be incredibly transparent with our findings. We want to give the community back what they've given us, and we want to be able to share with them everything that we've learned, as well as any other resources we find along the way. We also do advocacy and policy to advocate for change on a governmental level. And then we also do training. So we do team-based trainings, train the trainer programs to expand our trainings further in the community, and we do interprofessional training. We have an interprofessional staff. We have multiple different disciplines working on different research projects all the time to try and get a more well-rounded look at some of these problems that we're facing. I'm going to give it over to my colleague, Katrina.
So a little bit about the Center for Black Women's Wellness and some of our programs. Center for Black Women's Wellness offers a variety of programs that raise awareness about relevant health issues in the community and educates the community about risk factors and how to prevent that. And we do that through three core programs: wellness and women's health. We have a women's clinic. We have a breastfeeding clinic. Also, maternal and child health. That's through our Atlanta Healthy Start initiative, where we provide case management and home visitation services. And our economic health, we provide financial assistance and financial education. And we have a program called the Women Economic Self-Sufficiency Program, where we help our women to get small businesses. If they have an idea that they're doing in their home, maybe braiding hair, we try to help them do a micro business plan and execute that business as a source of income for their family. Next slide. So the Center for Black Women's Wellness, a little bit about our history. We began in 1988 in the Atlanta area. We've been around about 33 years. And like I said, some of our commitment is for uninsured health care, prenatal home visiting, and financial literacy and micro business training. We see about 33,000 people annually, and we serve individuals all over the Atlanta area, regardless of their race, gender. However, we service mostly Blacks, which make up 97%, and Black female, and 85% make up the largest part population, which is Black women. 69% of our individuals come out of the Fulton County Metro Atlanta area, which has the highest participation, followed by DeKalb and Clayton County. So we not only service Fulton County, City of Atlanta, but we do go outside of our county and serve different counties such as DeKalb and Clayton. 86% of the Atlanta Healthy Start participants are a maternal and child health initiative and under the federal poverty level of 90%. And most of our participants are receive Medicaid. Building on for the community, building on existing projects designed to strengthen our infrastructure and capacity. We have 4 new exam rooms. We have an enlarged nursing station. We also have a counseling room. We have a space to conduct telehealth. We also just required a new data system. ETO, we went from ETO to Apricot and MedTouch to MD Rhythm, and using the API to support the universal intake. So everybody that comes into our center, regardless if they're coming into the Women Economic Self-Sufficiency Program, Healthy Start, everybody gets that universal intake that crosses over each program. So we're able to keep up with the clients in that way with demographics, phone number, update emails, and all in that.
All right, so the specific study we're talking about today that I've touched on previously a little bit ago it was a pilot study integrating perinatal mental health services into community-based settings. So this was funded through the Detroit Community Academic Urban Research Center, the University of Michigan School of Public Health. We used a mixed methods approach, the collective impact framework, and the topics were identified as a priority to the community. So when we went out and asked what they needed, they talked about maternal mental health. And this was led both by the community and also by the center we just spoke of, which is led by Dr. Natalie Hernandez. So she was the principal investigator on this project. All right, so Katrina, do you want to speak to the community-based research?
Yes, mental health services research has typically left out community voices. Mental health care be consumer and family driven through the direct involvement of consumers and families in the development and assessment of services. So we use our community, our target base was our Atlanta Healthy Start mothers. And the setting is in our community.
All right, so the purpose of this project was to assess the mental and emotional health challenges of underserved women in Atlanta. We wanted to examine local priorities and sources of care for mental health among underserved women in Atlanta to be able to find some solutions to this problem. So one of the ways we did this was through a community action network. Katrina, do you want to speak to the community action network?
Sure. So the Community CAN is the Community Action Network. We did a collective impact framework. We had a common agenda. We established work groups. We have a strong backbone support, and we have over 200 community members representing families. And what we are doing is we work collaboratively with community agencies to come up with a solution to address issues related to maternal and child health. The primary focus of the CAN is reducing disparities in maternal mental health outcomes through cross-sector information sharing, collaboration, and linkages. The CAN utilizes the collective impact approach to achieve sustainable change. CAN partners are a diverse group of individuals and agencies representing local and state governments. So we use like workforce development, we have child care agencies, behavioral health agencies, family support agencies, academic institution, financial services, and fatherhood programs. And we meet every third Tuesday of the month from 12 to 2.
Another way we involved the community was in our research orientation. We worked with the community and trained them on how to do some of this research. We used a multiple intelligence framework. So this was pre-COVID when we were able to do this. So we actually did training that involved all 5 senses. So we did stuff with smell, with taste, with all these different things. We did multiple different methods. So we used media, math, music, role playing. And one of the main things we talk about is the teach back method. Teaching someone something and then having them repeat it back. To make sure that it was understood correctly. So we did these trainings, like I said, in person. They were a great experience to really engage with everyone a little bit more. So for the methods, we spoke to a small sample of 3 different unique populations. So we talked specifically to the perinatal Black women. We also talked to healthcare professionals, and we also talked to community outreach workers. The interview guide we created for these semi-structured interviews was informed by both survey work and also peer-reviewed literature. And the CAN, which is the Community Action Network, also helped to co-create based on women's lived experiences. It was highlighted with Black perinatal women before it was utilized for this. And then when we were analyzing it, we used a thematic analysis and we used NVivo qualitative software. So we did these in-depth interviews with the women themselves, with healthcare providers, with community outreach workers that were all, boots on the ground experiencing these issues firsthand or through their patients. So with settings, we try to find places that were comfortable within the community. We went to coffee shops. We did things within the community that were private areas where someone would feel comfortable to talk. We had a participant demographic survey that they took. The interviews took around an hour. We did give everyone an incentive to complete it. And then afterwards, they were transcribed, and there was also field notes associated with it. We did record all of the interviews. I believe there was one person that requested not to be recorded, but other than that, we recorded them all so they could be transcribed and reviewed further. So as far as for the demographics, for the perinatal Black women, their median age was 24 years old. For the community outreach workers, all the community outreach workers were Black, they were female, and they were both community health workers and also family support workers. The healthcare providers were primarily female, although there was one male that was interviewed. Their median age was 40. They were all Black, and they came from a variety of different specialties, from psychologists to behavioral health specialists, family medicine, counselors, social workers. So we got a wide array of different disciplines that provided some different perspectives. So now we want to go through some of the major themes that came out of this and also go through a couple quotes. So for family support workers, we saw that there was a lack of resources, a lack of a support system, self-medication, women were displaced and impoverished. There's stigma surrounding therapy and mental health. There's distrust and fear of judgment, and fears of children being removed from their homes. So some of the quotes that we pulled to share were, They don't trust very well in the people they're receiving services from because they don't look like them. They feel like they're being judged, maybe by the questions that are being asked. They may not like where it's being held. It's not familiar grounds. It's not that they don't feel safe. They feel out of place. And another quote was, "You have to understand that when you're displaced and you can work for whatever reason, lack of education and just various things, it takes a real toll on your mental capacity." And Katrina, do you want to share some of the themes from the women?
Yes. So some of the women say they feel like no one cares. They feel depressed, insecurities with being a mom. Doctors not listening to their concerns when they tell them they're in pain, they're just not listening. Lack of diversity of mental health providers. They want to go to someone that looks like them. No one asks them about their mental health. And some of the quotes were, "Because they don't be caring to me, they don't care. So it's just like, why waste your breath if they're not going to do anything about it? I keep telling them it hurts. It felt like I was just being torn apart. After they got her out, I felt everything afterwards."
All right, and then some of the themes that came up with the healthcare providers. There was no postpartum care after the 6-week checkup. There's a lack of insurance, prior mental health issues, lack of funding, anxiety and depression, environment and household trauma, and no screening tools tailored towards pregnant Black women. Some of those quotes were, "I want to get better. I want to be a better mom." They're very resilient in that. "I don't know how I know. I want to be better. I just don't know how." So overall, across all the different populations that we talked to, we saw a lack of support, the impact that social determinants of health have on maternal mental health. There's issues that need to be addressed immediately. There's the solutions need to be culturally relevant. There needs to be screening tools that can capture Black women's experiences. There needs to be unique systems in place to help Black women that are suffering with maternal mental health issues. And just there's a lot of repercussions to the way the system is functioning currently. So for the quantitative portion, there was recruitment through the Community Action Network through word of mouth. That was actually a really unique part that the research team originally thought word of mouth wouldn't be a successful way of recruitment, and the CAN came back and said, "No, this is really what we need to do. This is what the community will respond to." And they were right. It just shows one more way that, you know, listening to the community can really help you have the most successful research and outcomes. There was 5 community-based organizations that were primary recruitment sites. Paper surveys were completed between August and October of 2019. Over 300 Black women ended up completing that survey. And then a binomial logistic regression was employed to examine the predictors of symptoms of perinatal mood and anxiety disorders. So the results of that were the mean age, was 26 years of age. 55% of survey takers were single. 55% had education greater than high school. 50% were unemployed. 80% were insured, and 77% had a regular healthcare provider. With all that, we also looked at ACEs. So 49% of survey takers reported some level of emotional abuse. 29% reported living with someone who had a substance use disorder. 25% reported physical abuse. 24% lived with someone who had a mental illness, and 21% reported sexual abuse. This is a huge indicator of a lot of different factors as you go through adulthood, and seeing these extreme numbers of ACEs found in this population was staggering, but unfortunately, something that we somewhat predicted was going to come out of it, and it's something that needs to be addressed immediately. With this, also 56% of survey takers had the symptoms of a perinatal mood and anxiety disorder. This is a huge number. It again shows the need for there to be interventions tailored for perinatal Black women. And then Katrina, do you want to read this?
Sure. How are we then using that research to inform policy, to develop policy that actually works for Black mamas? The ones gave the Black Mamas Matter Alliance, a quote from her.
So one of the areas is local systems change. So there's different committees and alliances already in place that are working towards this that we've seen in our community. There's the Black Mamas Matter Alliance, the Maternal Mortality Review Committee, a maternal health stakeholder group, Postpartum Support International, the Georgia Chapter Advocacy Committee. There's the Georgia Perinatal Quality Collaborative, March of Dimes Maternal and Child Health Committee, Black Mother Breastfeeding Association, and Mental Health Advisory Council. So while we're highlighting this need for health and change, we also want to recognize there is really good work going on in Georgia and in Atlanta to help start to make some of these changes.
Yes.
And then the next steps that are coming out of this is dissemination, a diversified strategy to show the results of what was found, both on a local level, making sure the community knows what came out of this, but also on a statewide level, on a national level, to see the need for this. And then sustainability efforts, looking for new partners, more grant proposals to continue this work over time. And then Katrina, do you want to?
Yeah. So call to action. We were asking people to be compassionate, replicate the study in your community, ensure screening is happening and they're consistent. Reach your representative with messages of support for healthy moms and babies. Create awareness day a week around maternal mental health, and connect with a diverse stakeholder community organizers, community health workers, and providers.
All right, and then we wanted to leave a little bit of time at the end for any questions that y'all have. So if you want to put those in the chat or the Q&A, we are happy to answer them at this time.
All right, thank you so much for that. Sorry, I had a little bit of how do you recommend replicating the study?
So I think that in part goes with looking at your community specifically. A big part of our study was going into the community, seeing what they needed, talking to our community members. So when we're looking at implementing it in new areas, I think the first step is going into your community and seeing what they need, what areas they would suggest starting this in, and looking and kind of moving forward from there. Do you have anything to add to that, Katrina?
No, well said.
And then I do want to emphasize again the importance of involving your community, and really any research that involves them, making sure they're a part of the process, start to finish, as much as possible, because it does make a very big difference when they're a part. They have a lot of valuable insight. They're the experts on what's going on in the community. So just making sure that they're involved.
I saw their next step, and I hope that answered the question. I can pause there. Is there anything else to add? Move on to the next.
So we have, oh, sorry. I was just going to say, we have a couple different studies going on in the center right now. This study really highlighted the need for maternal mental health specifically. So we're doing a couple different things in different areas. One of the things we're doing is we're developing a mobile app to be used during the postpartum period in the late third trimester, and we're addressing mental health as a part of that. That's primarily going out in rural areas, not specific to Atlanta, to create another avenue for access and research through that. We're also doing a couple of things preventatively. We're looking at preconception counseling. That is going into place in Atlanta. So for that, part of it is we're doing some mental health screening. We're doing some substance use screening. So before someone even gets pregnant, let's talk about some of these issues and see if there's some preventative work that can be done on the forefront. So those are just 2 projects, but we've really woven mental health into almost every project we're doing right now because we've seen the need for it.
And as a part of our case management services that our women receive through the Atlanta Healthy Start, they also have access to a mental health therapist as a part of their case management services also.
Great. I know there's gonna be some like random, I know there's like a few questions on the offspin of that, but I'll go just in order. The next is, I saw your next steps are to do grant proposals. How do you envision your research and grant money will help Black mothers in Atlanta?
So I think that kind of goes back to what we were just saying. When we get money from a grant, we take that and put it right into the community. So creating interventions that will go into the community and help people there. So the grant can help fund different programs that we then take to the community. When we do that, though, we do try and put in place sustainability efforts. So when that grant's over, there's a possibility to continue the project in some capacity.
There's a question too about, I guess, defining community. When you say that, do you mean like the local health department? Do you mean like hair salons? Do you mean churches? What specifically, when you say it goes to the community, would you define? What are you talking about?
Katrina, do you want to answer that one?
So it goes to the community based partners. We have partners through the South Atlanta. We have partners through health organizations. We have doula organizations, local and government agencies, insurance, behavioral health. So it goes through those agencies.
And then with other projects as well, like if the community came back and said, hey, we think this would be great if we implemented it in hair salons first, that's definitely something we would take in and try and make a possibility. So when we look at where we're going to implement it, unless it's specifically stated like in the grant or something, it has to be a specific place. We do try and take into account where the community thinks it would be most effective.
Can you say something about how to, especially if you are getting started, to build genuine, authentic, trusted relationships with communities? If particularly, if you're coming from like an institution and you're starting this grant and you're wanting to build this community partnership.
So I know one thing I would say, I'd also love to hear what Katrina has to say on this. A lot of times when we're applying for grants, we already have community members on board. So trying to bring them as early as possible into the mix, it should truly be an equal partnership. So they're listed as a part of the grant application. The other thing is sometimes if you find some of those really key stakeholders that are really involved in the community already, they're a huge resource, and they can help kind of expand beyond what you can and help give some trust and some validity to what you're doing.
And also we have different groups that we use. Also, we have our Sister with Voices, which is our leadership group, and they govern the Sister Circle group. And what they do they are community stakeholders. They live in different communities throughout the Metro Atlanta area, and they're stakeholders in their community. They are voices for their community. So whatever research or studies that we bring to them, we get their buy-in first. Once we get the buy-in of our leadership group, Sister with Voices, then we let Sister with Voices take that information to the bigger group, which is our Sister Circle group, and get their buy-in. And once we get their buy-in, it normally works for us.
Thank you. How do you address so there, when there's screening and when there's, sometimes, especially with different institutions, like screening for mental health, or even now that there's like a national hotline to call, how do you address there being fear of bias or fear of being open about what might be happening at home or what you might be feeling? Have you experienced any of that? And then how do you address it?
So yes, what we do is we do an assessment on our everybody that comes through the Atlanta Healthy Start program. They get an assessment done, and through that assessment, it's a psychosocial assessment. And with that assessment, we assess their needs. And once we build that relationship, you have to build that relationship. You have to build that trust first. Once we get that trust and they begin to open up to us, we then let them know about the mental health services. Do you need to see someone? And it's someone that looks like them. It's someone that they can relate to and that they feel comfortable with. Because our therapist, she was born and raised in the inner city of Atlanta. And so these ladies, she's been through some of the same similar experiences that they have gone through. So she's very relatable to them, and they open up to her. And we have a great number of our women that is in mental health therapy.
And we are at time, but can we ask a couple more questions real quick that are coming in the chat? We can also follow up. We are tracking all the questions that are coming in, so we can follow up. One is that mental health service providers are difficult to locate. Have you found any unique and successful solutions to this?
So what we've done, we have mental health services not only through Atlanta Healthy Start, but we also have mental health services through our wellness clinic. And how we've done that is through our CAN. These agencies are part of our CAN partners. And we collaborate with those CAN partners to come up with protocols to refer our clients to. And that has been sustainable through our partners through CAN.
Great, thank you.
Yeah, I think I was just gonna say, I think the big thing that we keep saying over and over is just there's so much value in involving the community. They are truly experts, and a lot of problems that researchers face can be solved by involving the community. And with that, making sure it's an equal partnership again, not coming and saying, hey, I have this great solution, come join me on this journey, but going before you do that and say, hey, I see what problems you have, not even coming in and saying, I see you have this problem, going in and saying, hey, where do y'all need help? What do you think might work? Things of that, like that. And it usually provides a much more successful project.
That's great. I know we are at time. I was hoping to hear in 5 years, if you were to, in light of some of the earlier sessions and looking towards the future, what are some things that you hope to see to really innovate maternal mental health?
Personally,
5 years from now.
I think, having culturally centered care is a big one. I think people being able to see professionals that look like them, being able to have resources that are culturally relevant. I think that's a huge issue that we're facing. It's not having culturally relevant materials. And we're starting to see some of that change. We're starting to see things come out. But in 5 years, having some of those things, having, projects and different resources being tailored to different groups and different people, and being able for people to be able to be seen and heard, would be a huge, amazing thing to happen in 5 years.
And also, I think just having maternal mental health as part of prenatal care, part of your case management. If you're in an organization such as ours, Atlanta Healthy Start Initiative, just having that as being a part of your care.
Absolutely. Well, we are at time. Thank you so much for staying a little bit over. This was so impactful. Your work is so important, so impactful, and it really is an honor to be in presence with you and to be learning with you. And I hope that we can stay in touch. I know in the chat there's a lot of people that are asking to stay in touch with you, so we are capturing all that, and I hope that we do stay connected in this shared mission.
Yes, definitely. Thank you for having us, and thank you for everyone that stayed till the end and asked questions and was engaging. We really appreciate it.
Thank you.
Thank you, Katrina. Thank you, Madison. All right, we will see you at the film screening next.
Yes.
Take care.
Okay, bye-bye.